For decades, society has perpetuated a damaging myth that reaching 60 means the end of vitality, energy, and intimate wellness. We've been conditioned to believe that our bodies simply shut down, that passion fades, and that the spark of life diminishes with each passing year. But here's what the latest scientific research reveals. This couldn't be further from the truth. Your body at 60, 70, or even 80 retains remarkable potential for renewal, energy, and intimate wellness. The key lies not in accepting decline as inevitable, but in understanding how to work with your body's natural rhythms and needs during this extraordinary phase of life. Today, I want to share with you groundbreaking insights from recent studies in gerontology, endocrinology, and wellness research that will completely transform how you view aging and intimate health. We're going to explore a simple natural practice that science shows can enhance circulation, boost confidence, reduce stress, and maintain the vitality you thought might be slipping away. This isn't about turning back the clock. It's about embracing the profound wisdom your mature body offers while optimizing its incredible capacity for wellness and connection. The hidden challenge. What really happens in mature years? Let me paint a picture that might feel familiar. You wake up in the morning and instead of feeling refreshed, there's a heaviness that wasn't there in your younger years. Your energy feels muted, like someone dimmed the lights on your inner vitality. Perhaps you've noticed changes in your circulation, hands and feet that feel cold more often, or a sense that your body's natural rhythms have shifted. Many adults over 60 report feeling disconnected from their physical selves. There's often a gradual withdrawal from intimate wellness, not necessarily due to lack of desire, but because of uncertainty, physical changes, or simply not knowing how to maintain that vital connection with their own body. The medical community has identified several key factors that contribute to these challenges. Hormonal fluctuations affect both men and women significantly after 60. Testosterone levels in men decline at approximately 1 to 2% per year after age 30, with more noticeable effects becoming apparent in the 60s. For women, the years following menopause bring continued adjustments as estrogen and progesterone levels stabilize at lower baselines. Circulation changes represent another crucial factor. The cardiovascular system, while remarkably resilient, does experience modifications with age. Blood vessels may become less elastic, and the heart's efficiency can diminish slightly. This affects everything from energy levels to the body's ability to respond to physical and emotional stimuli. But here's where conventional wisdom gets it wrong. These changes don't spell the end of intimate wellness. Instead, they signal the need for a more informed, intentional approach to maintaining vitality. Research from the University of Chicago's National Social Life, Health, and Aging Project revealed that many adults remain sexually active well into their 70s and beyond. However, the study also highlighted a significant gap. Many individuals lack understanding about how to maintain intimate health during these years. The real challenge isn't aging itself. It's the absence of clear scientific guidance on how to nurture intimate wellness as our bodies evolve. The natural solution, understanding self-care and intimate wellness. Recent research in sexual health and gerontology has identified a powerful natural practice that addresses multiple aspects of mature wellness simultaneously: mindful self-intimacy and regular intimate self-care. Before we dive deeper, let's clarify what we're discussing. Self-intimacy, the practice of maintaining a personal, physical relationship with your own body, has been studied extensively in recent years. Scientists have discovered that regular, mindful, intimate self-care offers profound benefits for circulation, stress reduction, hormonal balance, and overall wellness, particularly in mature adults. This practice involves taking time to connect with your body through gentle, purposeful touch and attention. It's about creating moments of intimate self-awareness that honor your body's needs and capacity for pleasure and wellness. The science behind this practice is fascinating and multifaceted. When we engage in mindful, intimate self-care, several remarkable physiological processes occur simultaneously. First, the practice triggers the release of endorphins, your body's natural feel-good chemicals. These powerful compounds not only elevate mood, but also act as natural pain relievers and stress reducers. For mature adults dealing with the everyday aches and tensions that can accumulate over the years, this natural endorphin release provides significant wellness benefits. Second, intimate self-care stimulates circulation throughout the body. The physical arousal that occurs during these moments causes blood vessels to dilate, improving blood flow not just to intimate areas, but systemically. This enhanced circulation delivers oxygen and nutrients more effectively throughout your body, contributing to better energy levels and overall vitality. The hormonal benefits are equally impressive. Research shows that intimate activity, including self-intimacy, can help maintain healthier hormone levels. For men, regular intimate activity is associated with better testosterone maintenance. For women, the practice helps support natural hormone production and can contribute to better vaginal health and lubrication. Perhaps most importantly, this practice helps maintain what researchers call intimate confidence, your comfort and connection with your own body's capacity for pleasure and wellness. This confidence forms the foundation for all intimate relationships, whether with yourself or a partner. Benefit 1. Enhanced circulation and cardiovascular wellness. The circulatory benefits of regular intimate self-care extend far beyond what many people realize. When we engage in this practice, we're essentially giving our cardiovascular system a gentle, natural workout. During intimate arousal, heart rate increases moderately, similar to light to moderate exercise. This cardiovascular stimulation helps maintain heart health and keeps blood vessels flexible and responsive for mature adults. This regular, gentle cardiovascular exercise can be particularly valuable. The vasodilation that occurs during intimate moments improves blood flow throughout the body. This means better circulation to extremities, which can help with issues like cold hands and feet that become more common with age. Improved circulation also supports better wound healing, healthier skin, and more efficient delivery of nutrients throughout the body. Research published in the American Journal of Cardiology found that regular intimate activity was associated with lower risk of cardiovascular events in both men and women. While this research primarily focused on partnered activity, the physiological mechanisms, increased heart rate, improved circulation, and stress reduction apply equally to self-intimacy practices for individuals concerned about cardiovascular health. The practice of mindful, intimate self-care offers a gentle, enjoyable way to support heart health without the stress that some forms of exercise might create. The timing and frequency of this practice matters for optimal circulatory benefits. Research suggests that consistency is more important than intensity. Regular, gentle engagement provides more sustained benefits than infrequent, intense sessions. Benefit 2. Stress reduction and mental wellness. The stress reduction benefits of intimate self-care are profound and scientifically well documented. When we engage in this practice, our bodies release a cascade of stress-fighting hormones and neurotransmitters. Oxytocin, often called the bonding hormone, increases during intimate moments, even during solo practice. This powerful hormone reduces cortisol levels, your body's primary stress hormone. For mature adults dealing with the accumulated stresses of life, career changes, health concerns, or family responsibilities, this natural stress relief can be transformative. The practice also triggers the release of dopamine and serotonin, neurotransmitters associated with pleasure, satisfaction, and emotional well-being. These natural mood enhancers can help combat the depression and anxiety that sometimes accompany aging and major life transitions. From a neurological perspective, intimate self-care engages the parasympathetic nervous system, your body's rest and digest mode. This is the opposite of the stressed fight or flight state that chronic stress creates. Regular activation of this relaxation response helps maintain better sleep patterns, improve digestion, and overall emotional balance. Sleep quality often improves with regular intimate self-care. The relaxation and hormone release that follow intimate moments naturally prepare the body for rest. For mature adults who may struggle with sleep disruptions, this natural sleep aid can be invaluable. The mental health benefits extend to cognitive function as well. Research suggests that regular intimate activity may help maintain better cognitive performance and could potentially reduce the risk of cognitive decline. The increased blood flow to the brain during intimate moments may contribute to better neural health and function. Benefit 3. Hormonal balance and physical vitality. The hormonal benefits of regular intimate self-care become increasingly important as we age. This practice helps maintain more optimal levels of key hormones that naturally decline with age. For men, regular intimate activity, including self-care, is associated with better testosterone maintenance. Testosterone plays crucial roles beyond intimate function. It affects energy levels, muscle mass, bone density, and overall vitality. The use it or lose it principle applies here. Regular intimate activity helps signal the body to maintain hormone production. For women, intimate self-care supports several aspects of hormonal health. The practice helps maintain healthy blood flow to intimate tissues, which supports natural lubrication and tissue health. This is particularly important after menopause when estrogen levels are lower. Regular intimate activity also supports the production of DHEA, a hormone precursor that the body uses to create other important hormones. DHEA levels naturally decline with age, but research suggests that intimate activity may help maintain healthier levels. The practice affects the hypothalamic pituitary gonadal axis, the complex system that regulates reproductive hormones. Regular stimulation of this system through intimate activity helps maintain its function and responsiveness. Beyond reproductive hormones, intimate self-care influences the release of growth hormone, which plays important roles in tissue repair, muscle maintenance, and overall vitality. The deep relaxation and stress reduction that follow intimate moments can trigger growth hormone release, particularly during sleep. These hormonal benefits translate into real-world improvements in energy levels, mood stability, physical strength, and overall sense of vitality and wellness. Benefit 4. Improved sleep and recovery. The relationship between intimate, wellness, and sleep quality is profound and particularly relevant for mature adults who often experience sleep challenges. The neurochemical changes that occur during and after intimate self-care create an ideal environment for quality sleep. The release of prolactin, a hormone associated with satisfaction and relaxation, naturally occurs after intimate climax. This hormone promotes deep, restorative sleep. The reduction in cortisol levels that follows intimate activity also supports better sleep. Elevated cortisol is one of the primary culprits behind sleep disruption, particularly the kind of middle-of-the-night waking that becomes more common with age. By naturally reducing cortisol through intimate self-care, many mature adults find their sleep becomes more consistent and restorative. The physical relaxation that follows intimate moments helps release muscle tension that can interfere with comfortable sleep. Many older adults carry physical stress in their bodies from years of work, activity, or simply the gradual accumulation of minor aches and tensions. The full body relaxation response that intimate activity provides can help release this stored tension. Temperature regulation, which often becomes more challenging with age, may also improve. The circulation changes and hormonal shifts that occur during intimate activity can help regulate body temperature, leading to more comfortable sleep. Recovery and healing processes are also enhanced by the improved sleep that follows intimate self-care. During deep sleep, the body performs crucial repair and regeneration activities. Growth hormone release peaks during deep sleep phases, supporting tissue repair, immune function, and overall recovery. For mature adults dealing with minor injuries, chronic pain, or simply the everyday wear and tear of an active life, this enhanced recovery process can contribute significantly to overall wellness and vitality. Practical guidelines, frequency, and approach. The question of frequency is deeply individual, but research provides some helpful guidance. Studies suggest that for mature adults, consistency matters more than intensity or frequency. The goal isn't to meet some arbitrary standard, but rather to maintain regular connection with your body's capacity for intimate wellness. Most research indicates that engaging in intimate self-care 2 to 3 times per week provides optimal benefits for circulation, stress reduction, and hormonal health. However, some individuals may find benefit in more frequent practice, while others may prefer less frequent but more extended sessions. The key is listening to your body and finding a rhythm that feels sustainable and enjoyable. This practice should enhance your wellness, not create pressure or stress. Quality matters more than quantity. A mindful, relaxed approach that honors your body's responses and needs will provide more benefits than a rushed or pressured approach. Take time to create a comfortable, private environment where you can focus on the experience without distraction. Consider incorporating this practice into your existing wellness routine. Some people find morning sessions energizing, while others prefer the relaxation benefits before sleep. Experiment to find what works best for your body and schedule. Pay attention to your body's responses and adjust accordingly. If you have health conditions that affect circulation, hormone levels, or physical comfort, you may need to modify your approach. The practice should always feel good and supportive of your overall wellness. Remember that this is a form of self-care, not a performance. There's no need to achieve any particular outcome or meet any external standards. The benefits come from the practice itself, regardless of specific results. Inspiring examples, real-world transformations. Margaret, a 67-year-old retired teacher, came to understand the importance of intimate self-care after years of feeling disconnected from her body following her husband's passing. Initially hesitant, she gradually incorporated mindful self-intimacy into her wellness routine. Within a few months, she noticed improvements in her sleep quality, energy levels, and overall sense of vitality. Most importantly, she regained confidence in her body's capacity for pleasure and wellness, which enhanced her overall quality of life and even her interest in future relationships. Robert, a 72-year-old grandfather, had been experiencing the common challenges of aging, fatigue, poor circulation, and decreased vitality. His doctor had cleared him of serious health issues, but he felt stuck in a cycle of declining energy. When he learned about the circulation and hormonal benefits of regular intimate self-care, he decided to incorporate the practice into his routine. Over several months, he noticed improved energy levels, better sleep, and a renewed sense of physical confidence. He also found that his relationship with his wife improved as he felt more comfortable and confident in his own body. Dr. Patricia Williams, a 64-year-old physician, had spent years caring for others while neglecting her own intimate wellness. As she approached retirement, she realized she had lost touch with her body's capacity for pleasure and vitality. Through mindful self-intimacy practice, she not only improved her physical wellness, but also rediscovered a sense of personal empowerment and body confidence that enhanced every aspect of her life. These stories illustrate a crucial point. Intimate wellness in mature years isn't about recapturing youth. It's about embracing the unique wisdom and capacity of the mature body while maintaining vital connection to physical pleasure and wellness. Each of these individuals discovered that regular, mindful, intimate self-care became a cornerstone of their overall wellness routine, contributing to better physical health, improved emotional well-being, and enhanced quality of life. Addressing common concerns and misconceptions. Many mature adults carry concerns or misconceptions about intimate self-care that can prevent them from experiencing its benefits. Let's address some of the most common ones. The first misconception is that intimate self-care is somehow inappropriate or unhealthy at mature ages. In reality, maintaining intimate wellness throughout life is not only normal but beneficial for overall health. Medical professionals increasingly recognize intimate health as an important component of successful aging. Some people worry about physical limitations or changes that come with age. While it's true that bodies change over time, intimate self-care can be adapted to work with these changes rather than against them. The practice can actually help maintain flexibility, circulation, and comfort in intimate areas. Concerns about privacy and discretion are common, particularly for those living with family or in assisted living situations. Remember that this is a personal wellness practice, no different from other forms of self-care. Creating appropriate privacy and taking time for personal wellness is both reasonable and important. Some individuals worry about the time commitment involved. The reality is that meaningful, intimate self-care doesn't require lengthy sessions. Even brief, mindful moments of connection with your body can provide significant benefits. There may be concerns about decreased physical response compared to younger years. It's important to understand that the benefits of intimate self-care don't depend on achieving any particular level of physical response. The practice itself, the increased circulation, relaxation, and hormonal benefits provides value regardless of the intensity of physical response. For those dealing with medical conditions or taking medications that affect intimate function, it's worth discussing intimate wellness with your healthcare provider. Many conditions and medications can be managed in ways that preserve intimate health, and your doctor can provide personalized guidance. The science of timing and consistency research reveals interesting insights about timing and consistency in intimate self-care practices. The body's natural rhythms play a role in determining optimal timing for intimate wellness activities. Hormone levels fluctuate throughout the day and across longer cycles. Testosterone for both men and women typically peaks in the morning hours. This natural rhythm suggests that morning intimate self-care might align well with the body's hormonal patterns. However, the stress reduction and sleep benefits of intimate self-care make evening practice valuable as well. The key is finding a timing that works with your natural rhythms and lifestyle. Consistency appears to be more important than perfect timing. Regular practice, even if the timing varies, provides more benefits than sporadic practice at optimal times. This makes the practice more sustainable and realistic for most people. The body adapts to regular intimate wellness practices, much like it adapts to exercise routines. Over time, the benefits tend to compound with improvements in circulation, stress management, and sleep quality building upon each other. Seasonal variations may also play a role. Some research suggests that intimate wellness needs may vary with seasonal light exposure and temperature changes. Being attentive to these natural variations can help optimize the practice throughout the year. Integration with overall wellness. Intimate self-care works best when integrated into a comprehensive approach to wellness in mature years. This practice complements other important wellness strategies rather than replacing them. Physical exercise remains crucial for mature adults, and intimate self-care can actually enhance the benefits of regular exercise. The improved circulation and stress reduction from intimate wellness can support exercise performance and recovery. Nutrition plays a vital role in intimate health. Foods that support circulation, hormone production, and overall vitality will enhance the benefits of intimate self-care. This includes foods rich in antioxidants, healthy fats, and nutrients that support cardiovascular health. Mental and emotional wellness practices like meditation, journaling, or therapy complement intimate self-care beautifully. The stress reduction and emotional balance that come from intimate wellness create a foundation that enhances other mental health practices. Social connection remains important throughout life, and maintaining intimate wellness can actually support better social relationships. When we feel comfortable and confident in our own bodies, we tend to engage more fully with others. Regular medical care becomes increasingly important with age, and intimate wellness should be part of conversations with healthcare providers. Many doctors are comfortable discussing intimate health and can provide valuable guidance for maintaining wellness in this area. Long-term benefits and life enhancement. The long-term benefits of maintaining intimate wellness throughout mature years extend far beyond the immediate physical effects. This practice can contribute to what researchers call successful aging, maintaining vitality, independence, and quality of life as we grow older. Cognitive benefits may accumulate over time. The improved circulation and stress reduction from regular intimate self-care may help maintain cognitive function and could potentially reduce risk of cognitive decline. Bone health may benefit from the hormonal support that intimate wellness provides. The maintenance of better hormone levels, particularly testosterone and growth hormone, can contribute to bone density and strength. Immune function often benefits from the stress reduction and improved sleep that intimate wellness supports. Chronic stress suppresses immune function. So, practices that reduce stress can help maintain better disease resistance. The confidence and body acceptance that develop through regular intimate self-care often enhance overall life satisfaction. Many mature adults report feeling more comfortable in their own skin and more willing to engage in new experiences and relationships. Relationship satisfaction, whether with a long-term partner or in new relationships, often improves when individuals maintain their own intimate wellness. The confidence and comfort that come from knowing your own body translates into better communication and connection with others. Perhaps most importantly, maintaining intimate wellness throughout life represents a form of self-respect and self-advocacy. It's a declaration that your pleasure, comfort, and vitality matter regardless of age. Conclusion. The science is clear and compelling. Your capacity for intimate wellness, vitality, and physical pleasure doesn't have an expiration date. It simply requires understanding, attention, and the courage to embrace what your body offers at every stage of life.